Many countries are dropping their coronavirus restrictions, including wearing masks. Suddenly, we can see people's smiling faces again. Travel abroad is also becoming far easier. Thailand plans to ease travel restrictions for even the unvaccinated. And Zimbabwe is hoping to see visitor numbers grow again. Also on the show, smartphones and the internet have made it possible to stay connected with the world even in quarantine and lockdown. In Nigeria, you can now even plant vegetables using your smartphone. But first, let's take a look at the Ukrainian refugee situation in Germany. Most of them have no protection against the coronavirus. But many have no interest in getting vaccinated either, for very different reasons.
In this bus outside the shelter in the Bavarian city of Nuremberg, people who have fled the war in Ukraine can be vaccinated against COVID-19. This woman was the first person to turn up today. She doesn't want to be interviewed, but she tells us that she's nervous. She's getting the jab anyway because it will make life easier for her in Germany. There are other refugees who are also skeptical.
At the moment, there's simply not enough information on the vaccines, and there are too many open questions. This is why I don't want either myself or my daughter to be vaccinated against COVID-19. The vaccines haven't been researched well enough. We know that. There just hasn't been enough time.
It's estimated only a third of Ukraine's population is vaccinated, some of them with vaccines that are not recognized in the EU. Nuremberg's vaccination coordinator says the main goal is to inform people. That's also where the bus comes in.
In Ukraine, you can be sure there are exactly the same sort of myths concerning vaccination as here. For example, we often encounter people saying the vaccine will have a negative impact on fertility. So we do try to address those fears by providing information and reliable facts about what is really true and what not.
The low vaccination rate could become a problem, especially in refugee shelters. Around 200 people are being housed in the Nuremberg Exhibition Center. We're not allowed to film inside, but can speak to the doctor in charge of the medical care here. She says there have been fewer COVID infections here than one might fear.
To begin with, we were very concerned. We were expecting a test positivity rate of about 30%. We wondered where we were going to house infected people and how to isolate them. But then when the tests came back negative on a day-to-day basis, and we only had a handful of cases, we became less concerned. We've been able to isolate people who test positive without much difficulty.
Everyone here hopes it stays that way, and that vaccination rates increase. This young man fled from Belarus and joined the Ukrainians escaping the war. He's happy to get vaccinated.
I want to be vaccinated. Why not? I don't see the argument against it. If it's good for your health. Unfortunately, in Belarus, they still deny that COVID exists.
But it was another slow day at the vaccination bus. It seems word has yet to get around.
For many, being allowed to travel again is an incentive to get immunized. Tourist destinations have long adhered to strict entry requirements and have only eased them for the fully vaccinated. But in Thailand, that is now changing. Starting May 1st, the non-vaccinated may visit without a PCR test or having to quarantine.
The beaches in Krabi in southern Thailand are usually crowded in April. But the global pandemic still isn't quite over and tourism has yet to bounce back. Still, David Martins is optimistic. He works for Centara Hotels and Resorts, a leading hotel group in Thailand. In the last 2 years, when Thailand closed its borders to overseas visitors, many hotels temporarily shut. Even when they reopened, they weren't fully booked. But in recent weeks, the situation has started to improve.
The entry requirements into Thailand is improving. It started out being a little bit complicated and a lot of paperwork, but now the situation has improved considerably.
The number of bookings is increasing every day. And the hotel manager says visitors to Thailand are clearly thrilled to be on holiday again.
We are now starting to see travellers travelling from Europe, the Middle East, and now India. In terms of the business, we are sustaining enough business to operate the hotel without running at a loss, I suppose you would say. Most of our goal is to make sure that we can keep the hotel operating and keep the staff employed.
Unfortunately, the long-awaited upturn in the tourism industry has been dealt a fresh blow by the war in Ukraine. Energy and fuel prices have risen steeply. Taxi driver Kitty Kabut says that gasoline and diesel are getting more expensive every day. But she can't pass on the extra costs to the customers because taxi fares are set by the state. Moreover, there are no Russian visitors this spring.
From the airport to here, about 15 minutes. I buy gasoline, 500 baht, go to the Krabi airport, and then in the Krabi, tourists in the, not more people.
100.
Still, visitor numbers are likely to rise soon, not just in Thailand. After a 2-year lull, more and more airlines are resuming flights to popular destinations. German airline Eurowings, for example, is the first European carrier to resume flights to Victoria Falls Airport in Zimbabwe. Victoria Falls is one of the world's largest waterfalls, and visitors can't wait to see this spectacular natural wonder. As well as the equally spectacular local wildlife. At the Victoria Falls National Park, gamekeeper Charles Brightman is glad to be welcoming back tourists. He says that many people lost their jobs as a result of the pandemic. Brightman and his team find up to 10 wire snares every day. They mean a painful, long, drawn-out death for animals. Most of the poachers are locals who have no other way of earning a living.
Tourism is vital because it plays a direct role in supporting wildlife conservation. I have a saying, I say the more wildlife we have, the more visitors, which means the more jobs. Now, visitors come to Zimbabwe, sure, to see the culture, the people, but one of our greatest assets in this country is the wildlife. And people will pay, for example, entrance fees to enter the national park, and thus earning great revenue for the country.
Back in Krabi, Thailand, the rising cost of gasoline and diesel might be taking its toll on taxis and delivery businesses, but there's still light at the end of the tunnel. Though, as hotel manager David Martins explains, recovery isn't going to happen overnight.
I think we're probably looking at a longer term. We're probably looking more like 2024 before we'll see the same levels of business return. Obviously, it's starting to improve now.
The more countries relax entry rules for visitors, the sooner tourism will be able to recover. Some are happy about their new freedom to travel again and not having to wear a mask. But for others, it represents an additional danger. Can individuals protect themselves from infection while others are no longer being careful? Derek Williams, our science correspondent, tackles the following question. Does wearing a mask lower your risk of contracting COVID-19, even if the people around you aren't wearing them?
This is a question that lots of people are posing as masking mandates and regulations fall in many countries, including some with persistent high rates of infection. Here in Germany, for instance, people had to wear masks in pretty much all indoor public spaces until early April. But now they're no longer mandatory in places like shops, although some businesses have decided to continue requiring them. I have to admit that for the first time in 2 years, It's been kind of weird in the last few weeks to see bare faces in stores. Unmasked people even made me a little angry at first. I think because they reflect a fundamental shift in attitudes towards the issue. Somehow it feels like we've moved away from the attitude of, hey, let's all wear masks to protect each other, and more towards the attitude of, wear a mask if you want to protect yourself. But if nobody else is doing it, does it still make sense? All the expert opinions that I've read on this say that yes, it does. Though, of course, not all masks are created equal. One Japanese study that's regularly cited, for example, tested a range of facial coverings made from different materials, and it showed that even cloth masks help filter out potentially infectious droplets and aerosols during an exposure scenario. It also found surgical masks block them pretty well, while high-end respirator masks like FFP2s or N95s stopped up to 90% of them. So what does that mean in terms of infection risk? Well, in another study published by the CDC in the US, people who reported that they always wore masks in indoor settings outside the home had between 56 and 83% lower odds of testing positive for the virus than those who didn't, depending on what kind of mask they wore. Of course, those numbers are all pretty nebulous, but most experts agree that although universal masking is the more effective measure for limiting the spread of SARS-CoV-2 in populations, if you want to protect yourself, then wearing a mask indoors in public, even if other people aren't, is a lot better than nothing, especially wearing a high-quality respirator mask. But to really work well, of course, it also has to fit properly. So if, like me, you're going to keep wearing one for the near future while shopping, even if you don't have to, then definitely make sure it forms a good seal around the edges to provide the best protection possible.
Protecting yourself from infection is getting harder. Omicron, the currently dominant variant, is often mild, especially for those who are at least partly vaccinated. But how can you heal quickly if you get infected?
In the Berlin neighborhood of Charlottenburg, Dr. Ilke Akgün-Aydin runs a bustling general practice. He sees up to 60 COVID-19 patients every day. Their complaints are similar.
What we've seen most commonly over the past 2 years are symptoms like a cold, cough, runny nose, sore throat, fever, and then what's relatively specific to the disease are disturbances in smell and taste.
Today, Dr. Aydin is giving us some tips on what COVID-19 patients can do themselves to recover more quickly. His first tip, air your home frequently to reduce the viral load in the room. Fresh air is also good for the lungs, which are often badly affected.
What you can also do yourself for your lungs to improve the ventilation of the lungs and cough up mucus are breathing exercises, which you can also do online. There are a lot of videos on YouTube that have been made by clinics that take you through exactly how you're supposed to breathe.
Breathing therapist Andreas Saar demonstrates some lung exercises that can be done at home.
It's extremely important when you're sick with COVID-19 that you do breathing exercises, that you get out of bed, that you move, and that you strengthen your respiratory muscles.
In the breathing awareness exercise, a patient bends backwards while breathing in and forward when breathing back out. The goal is to be aware of exactly how the air feels flowing into and out of the lungs.
Breathing awareness exercises can help direct breathing into certain areas that may be less ventilated, that aren't as involved in gas exchange right now, and that can greatly improve their condition.
With this exercise, the patient breathes in deeply through one nostril, forcing the breathing muscles to work harder. Breathing exercises are good, but all forms of active sport are best avoided.
Basically, with infectious diseases, especially if there's a fever, there is an absolute ban on sports. There can be complications. Luckily, conditions like acute heart muscle inflammation are rare, because they can be fatal in some cases.
Sporty types will have to bring it down a notch during an infection. Nutrition also plays an important role in recovering quickly. Foods rich in vitamins and nutrients help, and drinking lots of water is important too.
Generally, it's good to eat, even if you don't feel like eating. So even if you don't have an appetite, we know that with viral infections in particular, eating is an important part of getting healthy.
Fighting illness and fever means getting a lot of rest and enough sleep. It's no different with COVID. All strenuous activity and stress should be avoided.
The good thing is that we realize ourselves when we have no strength. The body is busy fighting this disease with an activated immune system, so we know that sleep is absolutely essential, as is physical rest.
COVID patients need to quarantine. That means not meeting friends or relatives, and often being alone. But negative feelings can also have a negative effect on the course of the sickness.
It's important to maintain social contact. If you're alone, you can still talk on the phone. Nowadays, you can even see people on the phone with video calls. We need contact with the outside world, so as not to lose ourselves in our thoughts and get dragged down.
Keeping up with social and work contacts during quarantine and lockdown is no problem thanks to the internet. In Nigeria, you can now even plant vegetables and make money doing so by using your smartphone. And all that organically and without getting your hands dirty.
Agriculture is a big business in Nigeria. Whether you're plucking peppers or harvesting tomatoes, there's something for everyone's table and taste. But farming is also cool and becoming tech-savvy. Now, you can even manage acres of land using nothing but your mobile phone. And Rebecca Amao is the brains behind the operation.
Initially, our focus was just to curb hunger and ensure people could afford their basic needs for their home. But currently, we have all class of people wanting to be a part of the Farm from Your Phone programs. Currently, we have over 10,000 subscribers.
Rebecca is actually a computer science graduate. She wanted to find a technological solution to farming inefficiencies after seeing her mother and other farmers battle for many years. She originally founded Ray and Mo Farms in 2016 to solve the post-harvest waste problem. But during COVID, she witnessed many Nigerians struggling to buy food. Rebecca co-founded the Africa Wealth Initiative with other young professionals to create the program that allows everyone to participate in farming and reap the benefits.
I put in because my money can actually work for me, having a reliable team do something and I get benefit out of it, which was lovely.
I subscribed to Farm from Your Phone because it is actually a side hustle for me. I can easily farm on my phone instead of going to farm to run things. And then I'm getting my income on it. So it's so beneficial.
The market for remote farming is booming. And Rebecca is making sure that quality control is her top priority. For instance, she and her team are keeping the use of pesticides to a minimum.
We carry out soil analysis, water analysis. We study prevalence pests around and the climate condition of the place. That helps us understand the balance that exists in that environment already. So that shows us and mirror the kind of organic process to follow to both reduce the attack of pests and to increase productivity.
And that's how you go farm to market in the 21st century. Rebecca and her team have made it easier than ever to become a farmer with a swipe of your finger instead of a sickle.
In the southeast of the African continent, digital technology is helping to cushion the effects of the pandemic. Zimbabwe's courts have long had a reputation for working slowly, and COVID-19 restrictions have further increased the backlog of unresolved cases. But now, there is a solution on the horizon.
Zimbabwe recently broke new ground by conducting its first ever virtual court sessions with support from the United Nations. It's hoped that they'll make court operations quicker and easier, and also ease the backlog of unresolved cases. And that's desperately needed. Prisons are overflowing and people have experienced very long waiting times for their court hearings.
The prison population is now increasing. They are now crying, and we cannot tell the police to stop arresting. There will be chaos and breakdown of rule of law. So I'm happy that we are here today to witness this occasion where we are now officially opening the first of the virtual courts.
The court is connected to the police station and the prison online. The first virtual session took place in Harare in February 2022 before Yukai Zuda, the magistrate presiding over this theft case.
I'm applying for bail.
The trial of the accused had been delayed because of the pandemic.
Mr. Machinery, you are remanded to the 18th of February 2022, 8:30 a.m. in court number 6, whilst you are waiting to be transferred to the trial court on the 28th of March 2022 in court number 8.
But until the verdict is in, he has to remain in custody.
The use of smartphones and the internet have climbed dramatically during the pandemic. Young people in particular are increasingly looking online for interpersonal contact, entertainment, and bargain hunting, especially since people's social lives have been restricted for months. In Taiwan, smartphones have long since taken over the schoolyards, and that's causing new problems.
TikTok has more than 1 billion active users worldwide. Zheng Yisu from Taiwan is one of them. The student has more than 2,000 followers on the Chinese social media platform. She particularly enjoys listening to pop songs from China.
I know what's popular now, and I edit music and video. For example, China's famous songs, Shangxian Shou and Zhonggo Laozang. I can edit the video and song and upload it to the platform. It'll be a hit on TikTok. My content's all related to China because I love China's pop stars, and I don't like Koreans.
TikTok has 4.2 million users in Taiwan, and nearly 40% of them are teenagers or young adults. Lawmakers from Taiwan's ruling party accused China of conducting so-called cognitive warfare through its social media to influence young people here. In Taiwanese high schools, nearly every student has a TikTok account. And they're all very familiar with China's content on social media.
The content is all in simplified Chinese, probably uploaded by Chinese mainlanders. For example, some say the pandemic is made by the US and it's not from China, or some videos show how well China is controlling the COVID-19 pandemic.
He combines his photos into a video. Now he has over 6,000 followers. He can't even put his phone down during class. According to scientists, the trend is important to counteract, particularly among young people.
If you are immersed in China's strictly controlled social media environment for a long time, you naturally would look at China positively. But the China and the Chinese society shown on social media platforms is not the real China, and it will give young people in Taiwan the wrong impression.
To combat China's social media influence, some high schools in Taiwan have now started offering media literacy courses for students. And the Taiwanese government is also taking steps. Earlier this year, it said China uses hundreds of fake accounts to reach every corner of Taiwanese society. Taiwan is now planning to launch a task force to deal with Chinese cyber warfare during elections in November.
During the pandemic, much of our social, economic and political life shifted online. Many people will keep these new habits and perhaps only travel digitally in the future. That's it for today. Next week, we'll take a look at the long-term health and economic impacts of the pandemic. We hope you can join us. Until then, goodbye and stay healthy.